Federal Health Minister Ginette Petitpas-Taylor touched down in Sault Ste. Marie this morning to meet with MP Terry Sheehan. Sheehan has organized the minister's visit to the Soo to shed some light on two of the Sioux's biggest health concerns, the opioid crisis and seniors' health. On TV's Alex Parr has more.
A need for a new housing strategy and for a level 3 detox center were the cries for help Canada's health minister heard today at the Russ Ramsey boardroom at the Civic Center.
A few takeaways that I've learned today from this community: addressing the area of stigma and discrimination is really key. We need to make sure that frontline service providers and community members understand the issue of the opioid situation. We have to understand that this is a medical issue, it's not a criminal one, and we really have to have a collaborative and a compassionate approach in dealing with these people on the ground. I was pleased to meet with individuals here today and to get a snapshot of the work that is being done. Another issue that was discussed today is the need for more supportive housing. If we want to deal with people that are living with these issues, we have to make sure that they have a roof over their head. I'm very pleased that our government has put together a national housing strategy. Housing has been ignored for a number of years in this country, and now we're almost catching up. But with our national housing strategy, we certainly want to move forward in making sure that more housing units are available for Canadians, and also to make sure that the supportive services are included in those units. Well, to be very frank, I go to a lot of big centers, but I come from New Brunswick, which is pretty well a rural province, and I know that we have to make sure that we get a snapshot of what is happening in local communities and smaller communities. I was thrilled that Terry, over the past years, has invited me to Sault Ste. Marie, and he arranged this wonderful round table today, because we certainly want to know what is going on in rural Canada, in small communities, because their reality is not the same reality as bigger centers. So it was important for me to be here, and I'm going home with getting a better sense of what is needed in this area, and I appreciate the time that everyone has given me.
And once the meeting here is wrapped up at the Civic Center, the Canadian health minister will take her time over to Sault Area Hospital, where she will be discussing seniors' health in the city. For Sault Online and on TV, I'm Alex Parr.